A 69-year-old female comes to the hospital via ambulance. She can't move the right side of her body. She can't speak. She's having a stroke. We get a CT scan and we figure out that it's not the bleeding type of stroke, but it's the type of stroke where you're not getting enough blood to your brain. Unfortunately, she can't get TPA, which is the only approved drug to treat stroke because it's been over 4.5 hours, and if we give her the drug, there's a high risk she'll bleed into her brain. We do another type of scan to look at the vessels, and unfortunately, there's no clot at the base of her skull where someone like me can go from the groin or the wrist and get up into the brain and actually take the clot out. Ladies and gentlemen, this woman represents the over 80% of patients who come to hospitals across the United States with an ischemic stroke for which we have no acute treatment. And when there are 690,000 strokes in America each year, that's a problem. In fact, stroke now ranks #1 in combined morbidity and mortality across the world, yet we only are able to acutely care for a minority of patients. My name is Shahid Nimjee, and I'm an endovascular neurosurgeon. And for the last 14 years, I've been working on a drug that we have shown to open up a blood clot better than TPA, and we've designed a second molecule that can turn the first drug off within 2 minutes, therefore taking care of the biggest problem in stroke therapy today, which is bleeding. Now, I'm considered an expert in stroke therapy. Yet, it's taken me 14 years to get to this point in the development of this drug antidote compound. The truth of the matter is, I'm not even done yet. And secondly, as I've traveled through my journey in innovation, I realized very quickly, I am not the expert. Let me explain something to you when you think about the paradigm of drug development. First, you have to identify what you need to inhibit or what you want to target in order to develop an effective stroke therapy. So we're talking to protein biochemists, structural biologists, and hematopathologists. Then you actually identify the therapy and you say, okay, we developed the drug and we developed the antidote, but now you have to be able to test it in some kind of system so you know it's working. So now we're talking to folks who specialize in analytics and assays in order to tweak something that will actually get a response. After you do that, now you have to see if this thing works in a living organism. So now we have to do preclinical modeling, we have to talk to veterinary pathologists, and each way along this journey, I'm listening, and I'm learning, and I'm carrying their voice with me. I'm listening, I'm learning, and I'm carrying their voice with me. So now we have patents, we started a biotech company, I've worked with the FDA, and we're starting talks about clinical trials. And can you guess what I'm doing? I'm listening, I'm learning, and I'm taking these voices away with me. So here's the truth. When you think about innovation, you simply can't be an expert in something. How can you be an expert in something that hasn't been developed yet? It's impossible. And furthermore, why burden yourself with trying to be an expert when all you need to do is, one, be passionate about what it is you want to innovate. For me, it's to see that 69-year-old female stand up and walk out of the hospital after I've treated her. And secondly, to understand that as you travel through this journey, you just have to be learning. Just listen, because it's there. Thank you.